Well, hi everyone. Thank you so much for joining us. I am Jane Sagwe. I'm one of Polly's co-founders, and this is one of our first specialist chats. And today we have Dr. Amber Krogsrud with us. Also have my fabulous co-founder Sabrina, and we will be chatting with Dr. Amber about what naturopathic medicine is, what her practice style is like, what all the different sorts of whole body health treatments are that she uses with her clients, different types of testing, a whole bunch of stuff, and then we'll get into a fun Q&A at the end.
Yeah, fantastic. So we're doing this new video series here at Poly where we talk to different providers like Dr. Amber to learn a little bit more about their practice style, and discuss various hormonal health topics. So we're excited to have you, Dr. Amber, for one of our first chats.
Yeah, I'm thrilled to be here. This is exciting.
So let's just start off, Dr. Amber, by you introducing yourself. We would love to hear about kind of how you came to be a naturopathic doctor. I know that you live in LA, but would love to hear more about your practice and can just get going from there.
Yeah, so I'll give a little backstory. I was going to go the conventional route to be an MD and was really passionate about nutrition and mindset, and I did a lot of changes in my own life. And really, when I found naturopathic medicine and kind of contrasted it to what I was seeing in conventional medicine with kind of the insurance-based model and a lot of prescription medication use, I was immediately drawn to naturopathic medicine because I wanted to help patients truly regenerate. That was the word that really resonated with me at the time. I wanted to see their health reverse and see these transformation stories. And I just didn't feel like I witnessed that in the conventional system. And so that really got me into naturopathic medicine. And what I do a lot of right now, I'm based in LA, but I do work with a lot of women from all over. I have clients in Northern California and other states and even other countries. So I do, we can ship testing kits and we can ship a lot of things anywhere, which has been nice during COVID to have virtual medicine that really caters to the modern day busy woman who doesn't have a half day to carve out to drive to her doctor, park, sit in the waiting room, hour appointment, and then drive back in a city like LA. It's just not as feasible. So having the virtual visits, doing in-office appointments for the things that are essential like IVs, is great. But a lot of the lab appointments we can do virtually. We just screen share like we're doing right now, and
That's awesome.
Even easier. So naturopathic medicine. Let's talk a little bit about what that is and where I specialize.
Awesome.
Yeah. So essentially naturopathic medicine, the way that I like to define it and describe it is we're helping the body to do better at what it already knows how to do. So we're working in synergy with the body. Whereas a lot of times in conventional medicine, we'll come in, for example, if you have a skin rash, we will give you something to suppress your immune system so that your skin rash gets better, but we work through a suppression perspective. And in naturopathic medicine, we say, okay, hey, what's going on with your immune system here? Let's re-regulate it and work with the body on how it already knows how to function and make it more efficient and effective and figure out really what's the root cause of why this is happening, right? So taking that approach to so many angles, looking at autoimmune conditions, looking at, I specialize in women's health and hormones. So really addressing, okay, when a woman is having acne and having terrible PMS and migraines before her period, what's going on hormonally? Let's not suppress it with a medication and a birth control pill, which is commonly done. And of course, there's individual situations where sometimes we need to use medication, but in naturopathic medicine, we really want to use as much of what nature has provided to help our physiology work better. And with hormones, we think about liver detox, and we think about how that shows up on the skin, and we think about, those levels of estrogen and progesterone, and how they play a huge role. There's certain things in our environment that can throw those off. So it's really about kind of coming back home to supporting our body to do better at what it already knows how to do.
Yeah, no, really love that. And particularly when it comes to hormonal imbalances, taking the whole body approach is just so important because our endocrine system is so interconnected to all these other bodily systems. And so it really, from what we've seen with Polly, from what a lot of my friends and I have all experienced, it's a really, really proactive and efficient way to kind of figure these complex conditions out. But also love to hear, I know that you went to Bastyr and University in San Diego, right?
Did, yes.
Awesome. So would love to hear about like just the schooling behind being a naturopathic doctor. Um, would like to make the caveat to our audience that if you are working with an ND, you should be cognizant to work with an ND, a naturopathic doctor. If you do want to be getting someone that has had all of the schooling that Amber has had, there are traditional naturopaths out there also who are great and wonderful for a lot of different types of issues. But just be aware about the scope that kind of differs between those two titles. So with that though, Amber, would love to hear about what it took to become an ND, because I know it's pretty intense.
Yeah, and thank you for that distinction, because there is kind of a classical or a traditional naturopathic doctor, and they haven't gone through the functional lab training and a lot of the things that we've done. So what does it take to become a naturopathic doctor? Well, you need a 4-year bachelor degree just to apply.
Yeah.
So I did mine in biology and a minor in chemistry just because that fit the prereqs. It's a lot of science-based classes. And then once you have a bachelor's degree and you have a bunch of prereqs, organic chemistry, biology, all those done, then you apply, you get accepted, and then it's anywhere from 4 to 5 years of med school. So I did 4 years of training, and then I did a 5th year. So you can extend it, which is what I love about naturopathic medical school. No other medical program will allow you to do that. And what it allows, so doing it in 5 years instead of 4 for me made it more livable. I still had intense, training, and I was still putting in 12-hour days and lots of clinicals, but it allowed me to actually practice what I was preaching and learning in school, which is sleep and self-care and, exercise and mindfulness and everything. So the training, the first 2 years look a lot like conventional medical school. We have a whole year of cadaver dissection. We dissect the body from head to toe. That's a life transforming experience in itself. And then we do a lot of basic sciences, physiology, biochemistry, understanding how food, carbohydrates break down the body, a lot of complex basic science courses for 2 years. And then you jump into clinicals for several years, and I saw 1,000 patient contacts before I graduated. And you're at external sites, you're working in other offices, you're working in the student clinic. There's lots of extracurricular opportunities. I worked in like a homeless facility where we were treating patients. So I had a lot of different experiences, some high-end clinics in Hollywood, like literally saw everything, which is really fascinating. And we take care of pediatrics all the way to geriatrics. We're trained to care for everyone. Usually most people specialize. So I specialize in women's health, and I work with a lot of women age, 20 to 35, 40, but even menopausal women, perimenopausal, with hormone regulation as well. So yeah, it's an extensive training. It was 11 years of school for me by the time I graduated, and then a continual learning process for the rest of your life. So I'm one of those people who just loves to learn. Like even after school, I'm always digesting information and reading new books and, exposing myself to new things. So it takes that kind of individual to pursue a program like that.
Yeah, absolutely. No, that's super helpful context, and I think just so helpful for people to know that may have never worked with an ND before, just to understand all of the education that is behind it.
Yes. The other thing that we do learn too is blood draws and IVs. So a lot of times you'll learn that if you go to conventional medical training, but they don't really focus on IV therapy, and a lot of naturopathic doctors do, and that can be used very effectively for treatments. We can do IV chelation and with heavy metal toxicity and all sorts of other treatments with IV.
Yeah, no, I've never really gotten an IV treatment done before, but I've just heard that it's so super effective, and people that start just love it, and so that's helpful. And I also, for silly context, but have some friends that are doctors, and they will post pictures on social media of like the interns practicing IVs on doctors and stuff, and I'm always like, oh geez, I don't want to be one of those people. Um, but it's good that you guys are all trained in that kind of stuff.
Oh yeah, and I mean, you walk out of the lab with about 16 bruises and poke
Yeah.
marks. You're the dummy in the situation to, yeah, practice on each other. So it's quite the experience. Yeah.
Very cool. Well, we kind of touched upon this, but would love for you to just deep dive a little bit more on the benefits of taking a functional medicine or a whole body approach to women's health specifically. Um, we'll kind of just let you take it off here, but would love to kind of hear just about like how you view the benefits of taking that approach.
Absolutely. So it really, the human body is amazing, and it constantly blows my mind how complex it is. And a lot of times when I meet with a woman for the first time and she's coming to me for hormones, and we start checking in on, migraines and neurological things, and we're checking on her gut health, and is she having regular bowel movements, and it seems very unrelated, but the truth is that everything does impact everything, and the deeper you get into medicine, you understand how everything is so interconnected. If our thyroid is sluggish, we can't digest our food, we have low stomach acid. If that happens, we aren't assimilating nutrients, we get nutrient deficiencies, we end up not making neurotransmitters, and impacts our mood. I mean, everything is connected. It's so interconnected. So what we've done to a fault in medicine is that we've created a system where, you go see a neurologist if you have a problem with the brain or central nervous system, and you go see a GI doctor if you have issues with GI. And while that can be a benefit because they do specialize in that area, what they can tend to do is not assess all other aspects of that person, which is really crucial. So when I look at hormones, I am assessing so many other pieces. I do sometimes run, we could talk about testing in a bit, but I run other panels looking at neurotransmitter levels, looking at cortisol levels throughout the day. So what's the stress hormones doing? What's your sleep cycle like? Right? What's your circadian rhythm? We can map that out. And that plays such a big role impacting literally everything in a woman's body, her thyroid, her sex hormones, or estrogen, or progesterone, or testosterone, her sleep. I mean, cortisol just going through a stressful period can really throw a woman into a lot of hormonal havoc. And it's a very, very common experience. I went through it myself in med school. So yeah, I think it is, taking a whole body approach, seeing how every system does impact the other, and a root cause approach. So we aren't going to suppress. We're not just trying to get rid of the symptom for you. We're trying to figure out really what's driving all of these symptoms to happen, because those are all your body speaking to you intelligently, asking for help. And so testing and using some of the functional labs. So we assess labs from a different lens than maybe a conventional practitioner would. Yeah. So talk a little bit about testing, but we have a different range. So a good example is like vitamin D. I like to see that from 60 to 80 nanograms per deciliter. And a lot of times that would be lower potentially in a different practitioner's lens, but there is a functional lens that we're looking through that's, the standard values, if you go to a LabCorp or a Quest lab, they're really broad. So they're from the most unhealthy person to the really, really, really healthy person. They're very broad. And so a functional approach is to kind of narrow that down, say, what's the optimal? What is a really optimally healthy person? Where should their lab range be?
Absolutely.
And so we assess the lab ranges from a different point of view, which allows us to catch things before they get serious. Which is a huge advantage. I mean, I've caught things on patients' labs that, could have been ominous had they been screened through a broader lens, and somebody just kind of overviewed their labs. It all looked normal, and they had a ton of symptoms, and we looked at it through a functional lens. We had some functional labs, so I run kind of different panels of labs that differ from even just blood labs, although I sometimes do that. So
Yeah.
we can talk about some of those
Yeah,
lab
curious to
testing
hear
that
that.
we use in natural
Absolutely.
medicine, functional medicine.
And real quick before that, I do think it's important I think that understanding the difference between optimal and normal ranges for testing is just so important. When I was going through PCOS, actually, I was also pretty anemic, like severely anemic. And that
Mhm.
was like one of the first warning signs for me that something was kind of off, and I had gotten like a bunch of blood draws done by my GP, and it was all like right below normal. And so I got normal. And so I got put on an iron supplement. But then once I kind of took more of a functional medicine approach, we learned that like me being right below normal for my body was actually like severely below optimal 1 and 2, just really, really not good. I really, really appreciate that NDs and all functional medicine practitioners take that optimal lens approach instead.
Yeah.
Yeah, but would love to get into, you had been mentioning testing. Would love to kind of hear like the main tests that you might use with your clients. Just like a stereotypical woman that might come in complaining of like bad PMS, irregular periods, acne, just like a host of symptoms. And then also kind of what tests you would recommend for women that may have been dealing with the hormonal imbalance previously and are kind of in maintenance mode. Because this might be an assumption, it might be a bad assumption, but wondering if you're in maintenance mode, if maybe you don't need to get as many tests done, if there's a smaller number of things that you should kind of just be tracking.
Yeah. So most women, it's a great question, because there can be some differentiation based on how severe the symptoms are and where you're at. So most women that come to me, they've reached enough of a pain point that they're ready to see me.
Yeah.
Not always. Sometimes it is just a checkup, and they want some instruction and direction, and they're generally doing pretty well, but they have a few things. For the most part, women come in very symptomatic, very especially like perimenopause, menopause, hot flashes, can't sleep, the whole symptom picture. So my favorite test, and the test that I run the most, I would say, is called the Dutch test. And that stands for dried urine panel. And that test really gives just a wealth of knowledge. If you have to do one test for a woman for hormone health, that is the go-to. If she only has so much money and so much time, and it's a test that you can do from home, which has been really advantageous,
Yeah.
especially during COVID. And for busy moms that, scheduling an appointment and getting blood drawn and planning the fasting window and all of that's kind of a project. So the Dutch test, what it gives us is it gives us that cortisol rhythm, tells us about circadian rhythm, it tells us about melatonin levels, which play a huge role in a woman's ability to recover, and then in sleep. It tells us about even neurotransmitters. So it'll tell us about, dopamine and epinephrine, norepinephrine. So I can see if she's in a fight or flight state all the time. I can see if she has the precursors to make all of her neurotransmitters. We can see what her glutathione levels are. And this test stands out because it also provides a window, a picture into what's happening with a woman's liver detox of estrogen. And there's no other test that I know of that will do that. Blood tests, they don't even compare. They will not give you that information.
Yeah.
So we can look at all the metabolites of the hormones. And then if a woman is not detoxing her estrogens well, the Dutch test spells it out really beautiful in black and white and says, okay, it will turn into quinone, which is reactive and will damage DNA and put you at risk of estrogen-related cancers. And that's a huge deal if we can pick up early on, preventatively, if a woman's not detoxing her estrogens, if she's estrogen dominant, and not getting rid of them, we can prevent her risk of cancer through natural medicine. And I love that. I think that that's so proactive. And a lot of our medicine has been reactive. And so creating a proactive, let's help women support themselves better. They show up better in the world. They're better at their work. They're energized. And so I think, being able to address hormones in a holistic way, having testing to do that. And then the Dutch test also is really clear Once I have the results from that, it's a 6-page report.
Hmm.
It's really clear to me exactly what's going on and how to treat it. And so then we have a treatment protocol that's very individualized to that person's results. So if they're super high cortisol, we're going to give them certain adaptogens. If they're super low cortisol, we're going to give them, different adaptogens. But it's really individualized, which is the benefit of working with a practitioner and not kind of going out and picking out a bottle on the shelf and thinking, I hope this helps me. So it's very, very specific in how we go about testing and treating for hormone imbalance.
Yeah, no, that's awesome. Because it is, I mean, there's no one size fits all approach for this kind of stuff. And so having that level of detail is just so beneficial.
Yes. And there are other tests too. So
Yeah.
I do run stool testing. If
Cool.
there's, GI symptoms, we'll do that. Sometimes it's a first. Usually it's those two tests that I'll run, the Dutch test and a stool panel.
Cool.
And then, a lot of times, if we can run blood labs, I'll look at vitamin D levels, I'll look at homocysteine, I'll look at some of those inflammation markers in the body if a woman has autoimmune issues. And then there's actually an in-home thyroid testing kit that I've been using recently with
Nice.
great success as well. That's helpful during COVID because they can do it from home and it takes 5 minutes or less.
Yeah, absolutely. No,
So
the at-home tests are really incredible for access and just convenience and ease. They're really a win all from all perspectives.
I agree. Time saving, just ship it off to the lab, ship it to your house, and you don't have to go anywhere.
Absolutely.
Yeah.
Cool. So I guess like in addition to that, what are some of the like treatment strategies that you use with your clients? See a lot about IV drips on your Instagram and love that. I know that we had kind of chatted about it, but would love to hear more about those or other sorts of protocols that you put your clients onto.
Yeah. So I use I use botanical medicine. So what we're trained in as a naturopathic doctor is botanical medicine. We're trained in nutrition. We are trained in IV therapy. We are trained in pharmaceutical drugs. So I can prescribe when I need to, certain medications. So I actually use LDN, low dose naltrexone for autoimmunity for women. And that is it's a really small dose, but it does support autoimmune conditions. It's a medication, but it works. And then what else? I use IV therapy, and I've been doing some in-home IVs while everything's been closed up and people are, not feeling amazing at home. So the IVs, the reason why I love IVs, and I think that they do serve a purpose, is because of the prevalence of poor gut health. I mean, I would say that 75 to 80%, and maybe that's a underestimate, of people walking around on the street, if you just, took a group of people, they probably are not assimilating their nutrients as effectively as we want them to. So any food, any supplements, they're just not absorbing it well because of that one cell layer thick in the small intestine, what we call leaky gut, intestinal permeability. That is so common if you have had a period of chronic stress or issues, other autoimmune issues. You can almost verify that you have leaky gut. And so we know that you're just not going to absorb 100% of anything that route. So when we give it IV, it goes straight into the bloodstream. You skip the liver metabolism. It goes straight into the cell, and people feel better fast. And that's really helpful in chronic GI issues. Anybody with Lyme, anybody with mycotoxin, they usually have some gut issues that go along with that. So they just don't absorb as well. So IVs help. Or even IM. So I give a lot of like intramuscular, we can do B12, we can do glutathione, we can do all other sorts of nutrients that way too.
Very cool. And super nice compliment, I think, to like the rest of the functional medicine approach stuff, because a lot of lifestyle changes, nutrition changes and stuff, it can just take a long time. So it's nice to know that you can still work with a naturopathic doctor and get this like immediate relief in some cases. So it's a good, nice little two-pronged approach there.
Absolutely. And the other thing that I haven't mentioned, so peptide therapy is another thing that I use in my practice that is, a lot of people don't know about that, but it's
Yeah.
really amazing for women's health and hormone regulation. And so there's peptides essentially work to signal the body to help it do better at what it should be doing. It's just kind of lost its way or it's confused. So there's certain peptides that I use in autoimmunity. There's one called thymosin alpha. It's phenomenal for autoimmunity. And it essentially helps to re-regulate the immune system. So it improves T-reg cells, which are off in autoimmunity. And it really, I call it like an immune system reset back to what your immune system was when you were young. And so we know that women, when they turn 30, around the age of 30, their thymus gland involutes. They don't make those thymus peptides, which regulate your immune system. And so that's maybe one of the reasons why autoimmunity increases in women after the age of 30.
Yeah.
And so we can use peptides, we can use certain things that are in the scope of natural medicine to help re-regulate the body and just help it to do better at what it knows how to do. Yeah.
Awesome. No, that's super helpful. And I know a lot about this stuff, and I'm a huge geek when it comes to functional medicine and hormones, but I actually don't know about peptides, much about peptides. So I'll need to spend some time looking into that. It's super interesting.
Yeah, that's a fun one. That's going to grow. I'm telling you, that will be a huge, in the next couple of years, you'll hear more about
That'll be a big one. Nice. Well, you said it first, so we will. I also know that you do a lot of work with BHRT, which is bioidentical hormone replacement therapy. This is another area that I actually don't know much about. I know a little bit more about it in the context of perimenopause and menopausal women. But would love to hear just like kind of, first of all, for our audience, like one, what it is, two, what kinds of conditions or like sorts of issues that it might be applied to, and then three, when you know if this is something that you should be considering.
Great. Yeah. So typically, when we do want to bring on board bioidenticals, it's a situation where the woman's natural production is not possible. So when you go through menopause, your ovaries quit producing these hormones, and there's not a lot that we can do necessarily to stimulate that process to happen again. So same with a common use of bioidentical hormones in younger women is actually if they have a hysterectomy, which is more common than you would think. So I do have a fair number of
lots of them go.
Yeah, and so they do go through menopause, you know, in their 20s or 30s whenever they have the hysterectomy.
Yeah.
Depending on the severity and if they get a full hysterectomy or not. But that's going to be a time when we need to bring on hormones because we've essentially discontinued production completely.
Absolutely.
So they will start to feel just awful without those.
Yeah.
And yeah, I've seen bioidentical hormones in younger women bring them back to life after a hysterectomy. So it's really important, and it's obviously it's not advantageous. We don't want to start a woman that young, but the other alternative is her living brain fog, miserable, can't build muscle, you know, it's just a quality of life thing. So yeah, those are the two times. I typically, when I'm working with women that have not had a hysterectomy and they're not going through perimenopause, menopause, I will steer away from using bioidentical hormones. So there are maybe some exceptions, but for the most part, I'm using all sorts of other natural medicine. We're using herbs, shatavari, we're using evening primrose oil, we're using seed cycling, things to re-regulate the menstrual cycles and support her. Sometimes I'll use, there's like some topicals for progesterone that are not a prescription per se, but they can help with a woman who has an estrogen dominant situation. It can help to raise her progesterone. And that's done at a smaller dose. But for the most part, we're using diet, supplementation, lifestyle practices, and really saving the bioidenticals until we really need them, which is around perimenopause when things drop off.
Yeah, absolutely. No, it's super helpful, and I think it's, I mean, Sabrina and I really feel strongly that if it's a quality of life thing, absolutely bring medication in. And so it's good to know that there are some solutions for women who either have had hysterectomies or are going through early menopause, and helpful stuff to know for sure.
Yeah.
Awesome. Well, we're going to get into our rapid fire Q&A now, which Sabrina is leading. So let me get out of this PowerPoint.
Yeah, thank you so much, Dr. Amber, for all of that. Super interesting.
Yeah.
We got a few questions in from our community, and so I'll just kind of fire them away at you, and feel free to kind of just shoot your answers off. But the first one is related to hormonal acne. And so the question is, my hormonal acne has been hard to control after switching from a birth control pill to an IUD. Does it typically take time for hormones to rebalance? And I would even add to that question too, do you have any recommendations for this person about things that they might be able to do from a lifestyle perspective, nutrition, things like that to help with this?
Yeah, so this is a great question and a very, very common situation, I will say. Having acne, whether it be changing birth control, getting on IUD, and so here's what comes to mind for me when I heard that question. Birth control is delivering what we call exogenous, so outside of the body, hormones to the body. And when you're a young woman, you're already making a pretty good amount. I mean, if you have ovaries that are functioning, you're making your own estrogen and progesterone. So not only when you're on birth control do you have your own hormones, but you have a double dose of hormones to process. And where does that happen? It happens in the liver. And when the liver is overwhelmed, where does it show up? On the skin. So it sounds like there's a liver overload issue, and switching from the birth control pill, which generally will give you, depending on which one it was, but generally it'll be estrogen and progestin, both, to an IUD. And the most typical one that I think is used is Mirena, or the progestin only. So getting just that dose of progesterone, but still an exogenous hormone, and a synthetic form of a hormone as well. So not a bioidentical, but a synthetic form in the Mirena IUD. So that's a double, it's still a load for the liver to have to process all those hormones and get rid of them. And then the other thing that I think about and talk through for a lot of my women is, your liver only has, I think, like a threshold of like 3 or 4 holding spots. So if you're on birth control, and then you're taking, NSAID pain reliever medication often for some sort of pain in the body. And then you're consuming alcohol pretty frequently. Small amounts in moderation is not a big deal, but that can be overload. And then you add in any sort of other medication, like an anti-anxiety medication, or what else? There's all sorts of things that tax the liver. Yeah. Right? Besides hormonal birth control. So the women that come to me commonly, they have at least 4 or 5 taxes on the liver. And so it's like, what can your liver needs more support in detoxing and processing all those hormones, but then what are the other environmental things that are really taxing it even more? So it really comes down to a liver detoxification support for her. And I use a lot of things for that. My favorite thing to use is glutathione. So that's amazing for skin. It's phenomenal it's used for beauty, applied topically sometimes. And I actually inject that. If you have a naturopathic doctor, they can give you an injection of it. You can also take a liposomal form that's super bioavailable. So if you don't like needles, that's an option. I give that with IVs at the end of an IV, often, glutathione. And I will say after I take glutathione, my energy goes up because my liver is detoxing anything that I come into contact with in my environment. So that can be really supportive. There's all sorts of other blends of herbs and milk thistle and things that you can take to help support liver detox. But the other consideration is testing hormone levels. So seeing if she has elevated testosterone, that could also cause an issue with acne. Yeah. So, and birth control can absolutely throw that off and skyrocket testosterone. So yeah. some considerations for her.
Awesome. No, that's super helpful. I think, like you said, I think this is pretty common. Jade and myself, we've gone through, we have hormonal acne. I think It's definitely very common. So great information to have.
Yeah.
So the next question that we'll go into is estrogen dominance a recognized diagnosis? And we tend to get this question a lot through our Instagram. So would love just your thoughts on that.
Yeah, so I would say that estrogen dominance is a cause for a diagnosis, not an actual. So we have what we call diagnosis codes. So PCOS, for example, polycystic ovarian syndrome, we have a code that we bill insurance with. And estrogen dominance doesn't have a code like that. Similar to leaky gut, it's something that's a cause of so many conditions, but it's a root cause. So when a woman has estrogen dominance, she may experience many different things. Some of them would be pretty severe PMS, cramping, bloating, migraines around periods, or severe headaches. She could have fibroids, she could have any like breast tenderness, all sorts of symptoms with an estrogen dominance picture. There's a whole list, but it's more of a cause of a lot of these conditions.
Yeah, that definitely makes a lot of sense. Great. So the next question we have is related to coronavirus. Actually, I know we've talked a little bit about this in terms of at-home testing and access and things like that. But this is a question that came in for someone that had COVID, a pretty minor case of it. But they're saying that their periods have been messed up since that. And so curious what's going on there. I've definitely seen some things in the news over the past few months about this, maybe saying it's related to stress, but wondering if you've read anything about this or have any thoughts there.
Yeah, so I've seen this trend over the last several months where, and it's even happened for myself, where there's been a fluctuation in the normal cycle. And I think it is due to stress. We know that cortisol spiking can definitely throw off hormones. It can throw off your cycle. It can, change even immunity. We know that experiencing high levels of cortisol definitely modulate immunity around COVID. And then you add in, what it can do to your hormones. My suspicion is that it's related to the cortisol production. There could definitely be other factors. I mean, the world has changed a lot, but I think that, we know, and that's why I test that on the Dutch panel. It's amazing to see how that correlates with everything else. The stress and the cortisol picture is so relevant.
Yeah. And I have a question too around the Dutch test. With your clients, you tend to retest, like how often would you look back depending on treatments that you're doing to see if progress has been made, if different levels have changed? What does that look like?
Yeah, a minimum of 3 months. I never want to test before 3 months, just because I feel like if we do a protocol for 2.5 months or so, the body needs enough time to respond and adapt to everything that we've done. It depends on the severity and of the diagnosis and the woman and how symptomatic she is. Typically, I recommend twice a year, so once every 6 months.
Yeah.
But sometimes for people, once a year is more feasible financially. But if it's we're monitoring a lot of hormones and things are shifting pretty quickly, like 3 months, 3 to 6 months.
Yeah, great.
Not bad one.
Cool. So one final question we'll throw your way related to fibroids. And so the question is, I've struggled with fibroids for years. Is this due to hormones or something else? I'm sick of discomfort and really don't want to get surgery.
Oh, I know. It's an awful one. That is painful.
Yeah.
Yeah. So when I think about one of the causative things of fibroids, I think about that kind of estrogen dominance picture, and having a relatively high estrogen related to progesterone. So, and that can happen from a lot of things. One of the things that I always address with my female patients, but even with my male patients, is all of the environmental exposures we have that are estrogenic, that increase our estrogen levels. So all the plastics, I mean, even I'm drinking out of glass, but when I go to buy all my groceries, half of them are wrapped in plastic.
Yeah.
And they're in plastic containers. And so there's some of that that's unavoidable. We can do our best to avoid plastic exposure in the ways that we can in our drinking, things that we drink out of all day long, every day. And there's a lot that we can do, but then really what it comes down to is supporting the pathways of getting rid of that stuff. And that's digestion, and that's, making sure that we're moving our bowels. If we're constipated, we're not getting rid of our excess estrogen. It builds up, we get estrogen dominance. So there's so many factors to that. It can be environmental exposures, it can be birth control, it can be, even excess alcohol consumption can put you in an estrogenic place. There's lots of factors, but it's really just how can we support the body to detox those excess estrogen, and how can we eliminate the sources of it that potentially can contribute to fibroids.
Yeah.
So looking at a root cause approach for fibroids.
Great. Well, I mean, that was fantastic. Appreciate you answering all those questions.
Absolutely.
That's all we'll throw at you for today.
No, I thoroughly enjoyed that.
Thank you so much for taking the time, Dr. Amber. And I think we've all learned a lot. A really great way to kick this off.